Can you take Mounjaro if you have bipolar disorder? Bipolar disorder is not a contraindication to Mounjaro, but coordinated care between your GP, psychiatrist, and mental health team is essential before starting treatment. If you have bipolar disorder and you're considering Mounjaro for type 2 diabetes or weight management, you might be wondering whether it's safe to use alongside your psychiatric medication. This is an important question because managing both conditions requires careful coordination between your healthcare team. Let me start with some reassurance. Bipolar disorder is not an official contraindication to Mounjaro. That means having bipolar disorder doesn't automatically rule you out from using this medication. However, it does mean you'll need individual assessment and close monitoring from both your GP and your mental health team. It's important to know that Mounjaro is a prescription medicine and should only be started and monitored by a qualified healthcare professional. Mounjaro, also known as tirzepatide, is a dual GIP and GLP-1 receptor agonist. It works by mimicking natural hormones in your body that help regulate blood sugar and appetite. It's given as a once-weekly injection and is licensed in the UK for type 2 diabetes and weight management. The medication slows down how quickly your stomach empties and acts on areas of the brain involved in appetite control, which leads to reduced hunger and increased feelings of fullness. Now, why does bipolar disorder require extra consideration? There are a few important reasons. First, Mounjaro delays gastric emptying. This can affect how well oral medications are absorbed, including psychiatric medications you might be taking. If you're on oral mood stabilizers or other psychiatric medicines, this is something your doctor will need to monitor. Second, the gastrointestinal side effects of Mounjaro, like nausea, vomiting, or diarrhea, can cause dehydration. If you're taking lithium, which is a common mood stabilizer, dehydration can increase lithium levels in your blood. High lithium levels can be dangerous, so you may need more frequent blood tests to check your lithium levels whilst using Mounjaro. Third, if you're taking oral contraceptives, your prescriber may advise using additional contraception during the initiation period and after any dose changes, because the delayed gastric emptying may affect how well your contraceptive pill is absorbed. Your doctor will discuss the best approach for your situation. If you're using Mounjaro alongside insulin or certain diabetes medications called sulfonylureas, there's a higher risk of low blood sugar. Your clinician may need to adjust your other diabetes medicines to keep you safe. What about mood effects? Research on GLP-1 receptor agonists and mental health is still emerging. Whilst there's no direct evidence that Mounjaro causes mood episodes in people with bipolar disorder, any significant change in your routine, diet, or physical health can potentially affect mood stability, weight loss itself, changes in eating patterns, or the physical effects of the medication could all influence how you feel. That's why mental health stability should be considered before starting treatment. If you're interested in Mounjaro, here's what you should discuss with your healthcare professional. Make sure your GP knows your full psychiatric history and current medications. They'll need to coordinate with your psychiatrist or mental health team to assess whether now is the right time to start. Ask about monitoring plans. This might include more frequent check-ins, especially in the first few months, and additional blood tests if you're on lithium. Discuss what signs to watch for and when to reach out for help. Talk about how to manage side effects without compromising your mental health. For example, if nausea affects your eating routine, this could potentially impact your mood stability. Safety is paramount. You should contact your doctor or mental health team immediately if you experience any mood changes, whether that's feeling unusually low, elevated, or irritable. Sleep disturbances are also important to report, as changes in sleep patterns can trigger mood episodes in bipolar disorder. If you have any thoughts of self-harm or suicide, seek urgent help straight away. Contact your mental health crisis team, GP, or go to A&E. You can also call NHS 111 or the Samaritans on 116 123 at any time. Also report severe or persistent vomiting or diarrhea, especially if you're on lithium, as this increases the risk of dehydration and lithium toxicity. Let me recap the key points. Mounjaro can be prescribed to people with bipolar disorder, but it requires coordinated care between your GP and mental health team. The medication may affect absorption of oral psychiatric medicines and can increase lithium levels if dehydration occurs. If used with insulin or sulfonylureas, there's a higher risk of low blood sugar. Report any mood changes, sleep problems, or thoughts of self-harm immediately. Remember, this information is for educational purposes. Always speak to your healthcare professional for advice tailored to your individual circumstances. They can assess your specific situation and help you make the best decision for both your physical and mental health. Have you had experience managing multiple health conditions? I'd love to hear your thoughts in the comments. And if you found this helpful, please give it a like and subscribe for more evidence-based health information from Bolt Pharmacy.